It is common to wonder whether the color or consistency of your discharge is okay or whether you need to see a doctor. Different colors of discharge can indicate different states in your health. What is even this discharge to start with? Now, discharges are fluids that are secreted by tiny glands inside your V and cervix. Alright? Now, these fluids are washed down to remove dead and old cells and also to wash the V and other areas in your reproductive tract and keep them clean and safe from infection. Now, there are different colors that your discharge can take, and these are also what those colors can mean. Number 1, red. The shade of red can vary from bright to a dark rust color. Now, red discharge are usually blood. Yes, that blood that you see during your period is a discharge. Now, menstrual bleeding happens on an average around 28 days, though the normal range is between 21 and 35 days. Now, a period typically lasts for about 3 to 5 days. This kind of discharge, that is red discharge, should only come during the period. That time you are flowing, and if you experience bleeding between menstrual periods, then you need to see your doctor. Though there are many benign causes of intramenstrual bleeding, it can sometimes signal a serious condition. Anyone who has reached menopause and hasn't had a period for at least 1 year, then the period now comes suddenly, please see your doctor. It can sometimes be a sign of endometrial cancer. Yes. Number 2, white discharge. Now, the shade of white can extend to include cream or light yellow. Now, listen closely. In the absence of other symptoms, this discharge is most likely to be a sign of healthy lubrication. However, if the white discharge has a consistency like that of egusi soup, or it is accompanied by strong odor, it can indicate an infection. Please see your doctor. White, thick, strong smelling discharge is usually associated with a yeast infection, which can cause itching and irritation. Number 3, yellow-green. Now, if your discharge has a very slight yellow hue, then there may be no problem. It could just be as a result of change in diet or dietary supplement. Now, discharge that is a dark shade of yellow or yellowish green or even green usually signals a bacterial or sexually transmitted infection. See a doctor promptly if discharge is thick or it has a foul smell. Number 4, pink. Discharge can be light or a much deeper pink. It usually contains a little bit of blood. Pink discharge most commonly occurs with spotting before a period. It can also be a sign of implantation in early pregnancy. Now, some people experience a little bit of spotting after ovulation, which can also cause pink discharge. So, ovulation can cause pink discharge. Discharge can also be pink after sexual intercourse if the sex has caused a small tear or irritation in your V or the cervix. Now, number 4, clear discharge. Most ordinary discharge is clear or whitish. It may be slippery or have a consistency like that of egg white. A person is likely to experience more clear slippery discharge just before ovulation, during sexual arousal, and during pregnancy as well. Now, this one is not likely to be a sign of any infection. Lastly, gray. Now, gray discharge is not healthy, that is the truth, and it can be a symptom of a common bacterial infection called bacterial vaginosis. Now, bacterial vaginosis usually causes other vaginal symptoms as follows: itching, irritation, a strong odor, redness around the vulva and your V, okay, the vaginal opening. Now, anyone with gray discharge should promptly see a doctor. Following diagnosis and assessment, the doctor usually will prescribe antibiotics to treat your bacterial vaginosis.